reproductive endocrinologist here at Coastal Fertility, and I'm excited to be with you guys. What we thought we'd do in the new COVID era is that we would spend time with you and kind of go over a little bit about who Coastal Fertility is, why do we do what we do, and moving forward. I have some wonderful partners I have the pleasure of working with, and I would like to introduce you to all of them. First, I want to introduce you to Dr. Michael Slowey, who joined us here in Charleston in 2009. Is that right, Michael?
Yes, 2009.
Yeah, 2009. And then I want to introduce you to Dr. Cook, who joined us in 2014.
Hi,
and last is Dr. McLaughlin, who joined us last year. She's been here with us for about 14 months now or so. And what we wanted to do is kind of teach you in a COVID-friendly way a little bit about who we are and what we do and why we do what we do. We created a little kind of presentation for you on the slideshow, which we'll be able to go over today. And this is really part of a 5-part series where really today we wanted to spend time and kind of figure out, talk to you about why we created Coastal Fertility, how we created Coastal Fertility, and then talk with you about what the different talks are going to be along the way. We're going to talk about basic ovulation induction and infertility and evaluation treatment. We're going to talk about IVF. We're going to talk about egg donation. We're going to talk about egg freezing. We're going to do that all over time as we kind of move through all of this. And so I appreciate you guys being patient with us. You'll notice in the bottom right-hand corner, you have the ability to chat with us. That's a great place for you to type in any questions that you have along the way. We have Holly, who's here helping us along. And as questions come up, she's going to kind of ask us the questions and review them with us. And then with that, we'll kind of move on forward. Coastal Fertility was developed originally in 2012. This is a picture here of our baby party. We do a baby party generally every year and a half. For obvious reasons, that got canceled here in 2020. We hope to probably do one, depending on how COVID does, maybe in the fall of 2021, maybe even 2022. It's kind of sad to think about. It could take that long for us to get through that. But that's kind of our plan so far moving forward. Like you, we're being dynamic with regards to COVID and just trying to do things that make sense along the way. But this baby party really is one that really caught my eyes because we really believe what Walt Disney said as early on in his career. He said, all of our dreams can come true if we have the courage to pursue them. And so a lot might think, well, Walt Disney, a billionaire. I mean, of course, that's what he thinks. But little is it known that he actually went through bankruptcy 11 times before he was successful with Disney and Disney World and everything that he created. And so we know it's a hard journey going through fertility, and we want to be here to help you through that. And that's how we develop Coastal Fertility Specialists. Our job is to try to get you from the patient, as you can see here, who's agonizing over a negative pregnancy test, to hopefully to a consultation where you can learn about things that cause infertility and ways we can address those, to hopefully having a healthy, beautiful baby towards the end. And that's really what we're about, is helping you accomplish your dreams and your goals along the way. Now, that journey starts with having good quality physicians, and we really worked hard in getting good quality physicians. I'm very proud of my 3 other partners who I work with. We are all board certified specialists in our fields, and really double down in offering you what the best is, latest and greatest is in infertility evaluation, but also importantly, what the options and best options are for the fertility treatment side of the equation. Now, during our talks, there's going to be a lot of things we're going to talk about. I want to make it a recognition for you that infertility is not going to be your lifelong problem. It's going to be your speed bump. It's the speed bump that's in front of you now. I know right now it looks like a mountain, but it's a speed bump. And our job is to help get you past the speed bump and into the different causes and testing that we can do and some of the different treatment options. And that's what our 5-part seminar is going to do. It's going to go through all those different options that you have along the way. We know that infertility is common. It affects about 14% of all reproductive age couples, so it's very common. And that's about 28 million couples a year. Interestingly, if you look at a woman's lifespan, if you look at her normal lifespan, when she should be able to reproduce, probably about 25% of the time she can't. She has temporary infertility, whether that's due to a recent medical illness or maybe exercise or other things that she happens to be doing along the way. And so people can come in and out of fertility. One of the ways you can understand your fertility at the most basic level is, do you have regular periods? Sometimes if you're not having regular periods because of a medical disorder or stress or other things going on, that's an obvious sign that fertility may have changed a little bit. What a lot of people forget is that fertility is most of the time treated with simple things. We all hear about IVF, we hear about egg freezing, we hear about egg donation. Those are things we're going to talk with you about today. But at the end of the day, 60, 70, 80% of people conceive with very simple forms of treatment. And that's one of the things that we really focus on, is starting simple, figuring out what the lowest common denominator is and ways that we can help you move forward. In regards to who Coastal Fertility is, as you saw, we have 4 great partners, Dr. Slowey, Dr. Cook, and Dr. McLaughlin. All have fellowship training in reproductive endocrinology. So in some ways, we're the endocrinologist of the OBGYNs, and that nowadays has migrated into fertility evaluation and fertility treatment. We're all board certified in obstetrics and gynecology, which means we've done deliveries. I don't know that we would know how to do those anymore. I think Dr. McLaughlin might, but I probably wouldn't. And then we're either board certified or board eligible. Board eligible means after you come out of fellowship, you have to wait a year or 2 before you can take your boards. But the rest of the doctors are board certified in reproductive endocrinology. I'm very proud that we serve as the Division of Reproductive Endocrinology for MUSC. MUSC to me is a very good quality organization, and we're happy to give back and provide teaching and education to the OBGYN residents and medical students who are rotating through, and that helps us make the next generation of physicians better physicians. Train them a little bit about the evaluation and treatment that we do for infertility. Coastal Fertility has changed a lot over the years. We started as 1 office and then developed 2 offices. Now we have a total of 5 offices. Our main office is in Mount Pleasant. We also have an office which is in North Charleston, soon to be moving to Nexton. You'll hear more about that in just a second. We have an office in Lexington, we have an office in Myrtle Beach, and we have an office in Savannah. And so we really tried to build offices that meet the needs of our patients in those geographic areas. This is a picture of our Nexton office. It's as you can see, a diagram of what the office is going to look like. It's now currently under construction. We hope to have that office open by the end of December, which is our plan. And hopefully that will go according to plans. But in the meantime, we have a wonderful office in North Charleston, which is accommodating the patients who otherwise would be seen in the Nexton area. In our Mount Pleasant office, we provide all forms of infertility evaluation and treatment. Again, it's our kind of main hub. We do new patient visits, we do semen analyses, we do egg retrievals, we do embryo transfers, sperm counts, office-based surgery. Basically, everything can be done in our Mount Pleasant office. What we've developed is that a regional network, I kind of call it spokes on a wheel, that allows us to reach out to you so that a lot of your treatment can be done locally. And so this is a picture of our temporary North Charleston office, which is run by Dr. McLaughlin. And in that office, we can do all new patient visits. We can do ultrasound monitoring. We can do blood work. Our office hours are 7 in the morning until probably around 4 o'clock in the afternoon to actually see and work with patients there. In Myrtle Beach, we built for the Myrtle Beach area. We have 2 wonderful nurse practitioners who work up in our Myrtle Beach office. Debbie has been with us since 2012, and then Neely Shepard joined us about a year ago now, maybe 6 months ago, and she's training to be a primary nurse practitioner for us up there. In our Myrtle Beach office, it's visited by doctors frequently, where we can do new patient visits. We can do semen analysis, we can do intrauterine inseminations, we can do ultrasound monitoring, and a variety of different things in that area. So if you're a Myrtle Beach patient, you could get 90% of your care done right in the Myrtle Beach area, sometimes even a little bit more. This is what a copy of our Myrtle Beach picture of a Myrtle Beach office looks like. So we're on 48th and Grisham, right at that intersection, kind of in the nice central area of Myrtle Beach. In Savannah, we have a wonderful nurse practitioner. Her name is Haley, and Haley runs our Savannah office. We as doctors are down there frequently and do new patient visits, semen analyses, ultrasounds, blood work, and intrauterine insemination. This is a picture of what that office looks like. If you were a patient in the Savannah area, we could do everything down there except for the HSG, which is the x-ray to make sure the tubes are open and working. And if you needed fancier forms of treatment, egg retrievals and embryo transfers would be done up in our Mount Pleasant office. Now, the last thing to kind of talk about is, why do we have so many offices? I mean, how does that happen? Why don't we just kind of consolidate down? And we've really tried to focus on what we think matters. And what we think matters to you is customer service and patient care. And what we think matters to you is pregnancy rates. And it's our firm belief that top-tier pregnancy rates come from a top-tier lab. And a top-tier lab needs a tremendous focus of time, energy, and financial resources to make it a top-tier lab. A lot of quality assurance and quality control goes into making a top-tier lab. We have 4 wonderful embryologists who run that lab and a lot of embryology assistants who help support that lab. That involves using devices like isolettes, which allows the embryologist to work with the eggs and sperm in a protected environment that's maintained at body temperature and body oxygen levels. Same fluid that's in your body is where they're working while they're under the microscope. And then we have 4th generation incubators that we use to nurture the embryos along the way. And they take an incredible amount of maintenance and support over time to make sure they're performing at the level they want. A little bit of a personal story is that my daughter needed jaw surgery a couple of years ago. And we looked all over Charleston to find somebody who we thought was going to be good for that, and ultimately chose a doctor in Charlotte. It required a couple of visits to Charlotte to get it done the way we wanted it done, and we will always look back very positively at that. The surgery went well, and she did wonderful. And the message would be, if we can really develop the top-tier pregnancy rates and provide them to you, either locally because you live in Mount Pleasant or an hour or 2 hours away, we think at the end of the day, you'll see the benefit to that. There are national societies that monitor and report on audited pregnancy rates. The place I would like to direct you to for that is the Society for Assisted Reproductive Technology. The website link is www.sart.org, SART.org. And if you have questions about what any center's pregnancy rates are, most centers are subscribing to SART and a member of SART, and their pregnancy rates are reported there. Our pregnancy rates are reported there, and I encourage you to look at those pregnancy rates. I think you'll be pleasantly surprised. So we're very proud of what we've built over time. In regards to why do we do what we do, we all have families. All the doctors have families and kids who we love, and they're the center of our lives. And we are firm believers and have a conviction that through the appropriate testing and treatment, we can figure out what your cause of infertility is. And then through that, we can actually help with persistence find the best form of treatment for you for that. And so we believe that with persistence, the pregnancy rate is close to 100%. Now, sometimes we got to be creative to get there. I mean, there could be people who came in without a uterus, or maybe bad scar tissue within the uterus, or maybe without eggs, and we would have to use egg adoption. There's many different things that we might need to do to get to that 100% chance of pregnancy, but it's about persistence. It's about understanding the cause of infertility and being persistent to help you get there. And it's also our firm belief as doctors that if you're receiving bad quality customer service and support, that you're not going to be as easily to do the persistence and get to where you want to be. So if we're going to be successful for you, we need to be good for you and helpful in getting you to where you need to go. We're not perfect. I want to be the first to say that. And if we make a mistake and do something wrong, we're human, and we will apologize for it and we will make it right. What we ask of you, and what I ask of you more than anything else, is if something's not right, just let us know what it is. Maybe we did know it wasn't right. Maybe we didn't know. We'll fix it and want to make it right for you moving forward. Coastal Fertility has over 50 years of physician experience. I won't tell you who has the most, but we all have about 50 years total collective experience. I think that matters a lot because every patient is unique and has a unique individual response, and that response is going to be customized along the way. We all talk together. We have a noon meeting where we review every patient being evaluated together, all the doctors to come together, share their thoughts, concerns, and ideas. And there's no doubt in my mind that that improves our pregnancy rates, that we all work in a coordinated fashion together. And so with that, we've performed over 20,000 ovulation induction and intrauterine insemination cycles and over 10,000 IVF cycles, so we can kind of customize the response a little bit along the way. I've always believed that I never want to be the first doctor to prescribe thalidomide. but I never want to be the last doctor to prescribe prenatal vitamins either. And so our job is to be a cutting edge center that's providing good quality care for you in a safe environment. And I'm proud that we have been the first center to provide ovarian tissue freezing for a patient with cancers, the ability to take tissue out and freeze it and transplant it back later. And very importantly, a technology which has really come fast around the corner is the ability to freeze eggs, freeze that individual egg. We can freeze embryos. We've been able to freeze embryos for many years. Freezing eggs has been the bigger challenge. And so egg freezing now has developed where we've had the first, second, and third babies born in the state of South Carolina from egg freezing. I'm very proud of our embryology team. We're only one of 16 centers in the United States with egg freezing certification, to the point that Jeff Gray, who's our senior embryologist, just won a big award. I think it was probably 2 days ago, where he got a little champagne and a trophy. I think he's still probably feeling that champagne. It's so fresh. But he won a wonderful award for his egg freezing technology and his good success rate. So that's important, because if you come through to freeze your eggs and you end up at a center that doesn't have a lot of experience, you might find that your eggs didn't survive as well versus a center like ours that has a lot of experience. We gain that experience through our ability to freeze eggs and egg donation, and that generally has worked out very well. What are we doing about COVID? Well, COVID is a concern for all of us, and we are closely following the CDC guidelines. And along the way, we're wearing masks when we're with patients and during all patient contact. We did not slow down much for the COVID crisis that happened in March. We felt that we could do it safely, and I'm very proud to say that no patients, through good social distancing and mask wearing, contracted. No patients got COVID, and no staff members got COVID from care. We've continued to provide safe care along the way. If you are uncomfortable in any way with the care in regards to how we're approaching COVID, we look for your thoughts. But we have every intention of moving forward and not letting COVID hurt and change our lives along the way, that we're still going to be providing fertility care and counseling patients along the way. So our virtual seminar, I'm going to start introducing you to our docs who are going to be doing a lot of the talks. Seminar, as I mentioned, is going to include evaluation with ovulation, induction, and intrauterine insemination by Dr. Slowey, in vitro fertilization would be something I'll talk about. Dr. Cook's going to talk about egg donation. And so with that, I'm going to hand the situation off to Dr. Slowey.
Thank you very much. Yeah. I appreciate it. Let's see, which side's going to work best? What do you ladies think? Let's go with this.
It's right there.
All right, it's very odd to sit here and talk to you without a mask on. My children say I'm better off with the mask on than I am off, so I apologize for that. I'm originally from South Bend, Indiana. My dad was a professor at the University of Notre Dame, but I would end up going to the University of Tennessee on a swimming scholarship. 11 years and 3 degrees later, I would have my medical degree. But it was actually my graduate school degree that set me on the pathway to reproductive endocrinology. I worked in an ovarian physiology lab, and that's what got me started on this. And it was a science that really hooked me into this field, because there's a very rapid transit between the basic science and the clinical science in this field. So for me, it's very enjoyable to spend the time reading and looking at basic stuff and be trying to figure out how we can see it filtering into our care relatively quick. I have a residency at the Naval Hospital in San Diego. My fellowship was at Michael Reese in Chicago. I was the division head at the Naval Hospital in Portsmouth, Virginia for 4 years. And then after that, I spent a short time in the Charlotte area before 8 years at Reproductive Medicine Associates of New Jersey, which was a great learning experience for me. I moved down here to be with my family because we worked really hard in New Jersey. It's not that we don't work hard here, but I think we have a really, really good balance between work and our families. And it's my family is what motivates you. The joy that I have with my children is what I'm trying to bring to you. And my kids are 16, 20, and 22, and every bit of it's been fun. I have to say I miss the 4 to 8 year olds, but it's all been cool. Now, what ultimately I'm going to talk to you about next week, as you guys are recovering from the election, is going to be our basic infertility evaluation and our most basic therapy, the use of fertility drugs combined with intrauterine insemination. And basically, I think it's really important for you to know, why are you here And then how are we going to work our way through that? Because it's the evaluation that is going to dictate what treatments are appropriate. And John and Heather and Jessica are going to go through all the different technologies that we have. And there's a whole bunch of things that we won't get to, but just to give you an overview of what we have. But I like to start with the basics because I like setting the base. I look at my job as a teacher. Like I said, my dad was a professor, so I like the teaching aspect of it. And each time I see you is an opportunity to teach, to give you good information so that you can make the decisions that are best for you. So I will look forward to seeing you next week. I hope everyone survives next Tuesday, and we'll have a good time at that point. Now, Dr. Schnorr is going to talk to you about an overview of in vitro fertilization.
All right. Well, that was awesome. In regards to the second talk in our seminar is going to be me talking a little bit about in vitro fertilization. My name is Dr. Schnorr, and I'm also a reproductive endocrinologist. And my interest in reproductive endocrinology came actually when I was a resident, and we had infertility, my wife and I having our second child. And with a little bit of help, we were able to get to where we wanted to be in regards to pregnancy. And so we have two beautiful kids who are now in their 20s, and I'm very proud of them and everything they've done. But along the way, kind of saw that interest in the ability of helping couples who otherwise couldn't get pregnant to have children. I trained at the University of Virginia, which is where I did a residency, did a fellowship at a place called the Jones Institute in Norfolk, Virginia, and had the pleasure of training with Howard and Georgiana Jones, who had the first IVF baby with gonadotropins in the world. They were an amazing couple, and it's neat to learn from them and how they became as formidable as they were in regards to helping the fertility field. And I came here in 2001 and have been here ever since. I love what I do. I love spending time with patients. I love getting to know patients. I mean, the fun of what I do is getting to know you and your journey and helping you get to the journey. I love, unfortunately, seeing patients come in anxious and nervous and wondering if they were going to have a baby, and see them come back in 2 years later with Cheerios falling out of their pocket and a child on their hip and kind of barely getting in and ready for baby number two, and just seeing how that world changed for them and knowing how it will continue to change. I love the Christmas season when people send cards and remind us of who we've cared for over the years. It kind of reminds me of how old I'm getting over time, but it still makes it enjoyable and fun. During the second part of the seminar, we're going to talk about IVF, who needs IVF, common questions: how many eggs will you make? How many embryos will you make? How many embryos will you put in? What will the pregnancy rate be? What will the cost be? Those are all things that we'll talk about along the way during that seminar. Our goal is to make each of the seminars about 30 minutes or so in length, with plenty of time for questions and answers at the end. So the next person I would like to introduce you to is Dr. Heather Cook, and she's going to talk to you a little bit about her talk.
All right, let me get organized here. So as Dr. Schnorr mentioned, my name is Heather Cook, and I am the California girl of the group. I was born and raised in California and did all of my training out in Southern California, both at UCLA and University of Southern California. So the West Coast USC. I was lured out here about probably 6 years ago for the same reasons, kind of better lifestyle, just the Southern hospitality and just beautiful Charleston. And honestly, to join just a really great practice with great people all around, who anyone who's been to our center knows that our staff really loves all of our patients and really are wonderful people. So that's kind of my history getting here to South Carolina. I went into infertility a lot for the same reasons that everybody else has mentioned. I really love working with women and working with couples on such an important part of their lives. I also, as mentioned, have 3 children. They're the most important part of my whole world. And it just gives so much joy for us to help families also kind of obtain that for themselves. Anyone who's gone through treatment with us or anywhere else knows that when you're doing fertility treatment, you have lots and lots and lots of visits to the center. So we become very close with our patients. They truly become part of our Coastal family, which is really special. And anyone I see out and about in the area that is a long-term patient gets a giant hug and warm wishes from us at all times. So let me go through what I'm going to do for my seminar. I'm going to be talking about egg donation, which is a little bit different than kind of standard fertility treatment using your own eggs. So we're going to talk overall about who really needs egg donation. So you would kind of know coming in what would be indications for this, what would be signs that your doctor may recommend egg donation to you, which may be age, maybe issues with your egg quality, or maybe possible genetic issues you carry in your eggs. We'll go through in detail how we select egg donors and how you as a patient will be able to find and match with an egg donor. We have a very large egg donation program at Coastal, so there's a lot of different options for that, which is great because you can really find an option that works for you as a family. And then we'll go through in detail kind of what the process of egg donation involves, so you really know what to expect when you're going through the treatment. And obviously, probably the most important part, what the success rates are. And again, like most of our fertility rates due to our great embryology lab, we have very excellent fertility rates with our egg donation cycles. My talk is November 17th at 6 p.m. Be there. See you guys then.
And then let me introduce our newest partner to you. This is Dr. Jessica McLaughlin, who's going to talk a little bit about egg freezing.
Hi, everyone. Like Dr. Schnorr said, I'm Jessica McLaughlin. I joined this wonderful group about a year and a half ago. Basically across the country from Dr. Cook. I am originally from Vermont. I then trained and practiced in San Antonio, Texas before moving back towards the East Coast. Like the other doctors, we all travel to our regional offices, but I am primarily located in our North Charleston office, which we are very excited, which will soon be our next in office. And so for my talk, we're going to be talking about egg cryopreservation or egg freezing. And we're going to discuss who should consider egg freezing and when is the optimal time to do this. We'll also go through what testing we need to do beforehand and what does the actual cycle itself entail. And lastly, we'll go through what to expect and what are the pregnancy rates. So I look forward to seeing you on December 1st at 6 p.m.
All right. Thank you, Dr. McLaughlin. All right. Well, next kind of on the summary is just to kind of go over with you some of the things that I really want to bring home with you is that infertility is very, very common. Affects about 14% of all couples, which is about 28 million couples. And over a woman's lifespan, about 25% time she'll go into and out of infertility. And those are things that we can help understand and assess. The majority of infertility is treated with simpler forms of treatment. I know everybody thinks that it's always about IVF and that's always what we do. At our center, probably 60% of all pregnancies come from simpler forms of treatment. It's not that we're not good with the IVF, it's just that not as many people need it. IVF fixes, block tubes and low sperm counts and other things, but we just need to figure out what we have and kind of start as simple as we can along the way. A lot of patients sometimes a little reluctant, maybe being reluctant to come in and be seen. Maybe doing a virtual seminar makes it a little bit easier to kind of anonymously log in. I want to encourage you to ask questions. I know some questions are coming in and we're going to address those all at the end today. But, we all agree with you with just what you're thinking is that fertility should be a natural event. We 100% agree with you. We are committed to helping you find the cause. We've never told a patient that they can never get pregnant because we don't believe that. We think if the most extreme circumstance comes in and you don't have ovaries and you don't have a uterus and you don't have a partner or your partner doesn't have sperm, we're going to have to be creative. But, we can use an egg donor and a sperm donor and a gestational carrier and get the job done. And so we can get to where we need to be if that's something that needs to be done. So don't feel like you're going to come in and we're going to tell you it can't work and go ahead and go home and buy a boat instead. That's not who we are. We'll help you figure out what it is and what the cause is. As I mentioned, some people feel we're just going to beat the IVF drum along the way. That's not what we do. We're going to start at the beginning and help you understand all your options. And you don't need permission in America to see a doctor or to see a specialist. And so I think sometimes the specialist has the ability to see it a little bit quicker and easier because they see it and do it a lot. As I mentioned earlier, you probably wouldn't want me to do your delivery. I don't know if they come out head first or feet first anymore. I kind of forgot all that kind of stuff. But the fertility side of it, we do have figured out. We have it figured out well. So we're here to help you. And my hope is you'll see that if you have a problem, that you want to gather a little facts and better understand that. You being here is not a commitment. We're not asking you to sign anything. We're just here to educate you. It's simply an appointment. You can schedule that appointment through our website, or by calling us directly. The phone number is 843-883-5800. You'll find our website to be a tremendous resource if you have specific questions along the way, with a lot of videos that can go over things. We've built a program now that has 11 registered nurses, which is amazing, with over 76 years of experience. Why does that matter? Because a lot of your conversations are going to be guided by the registered nurse who's guiding you through things. We'll make the plan and agree to the plan, but you need somebody who helps kind of put all that together, and the registered nurse will help you with that. They're a wonderful team. We have an embryology team who I'm continually impressed with. Our pregnancy rates we're very, very proud of. I encourage you to go to the national website, audited by the Society for Assisted Reproductive Technology, to help review that. We've also won several national patient satisfaction awards, which to me I'm even more proud of than the pregnancy rates, because this is a nervous time, a challenging time, and we can help you get to where you want to be. So next step would be, if you're interested, call us and we can schedule a consult with you. We actually are doing telehealth consults. We can do consults by phone. We prefer consults in person if you're comfortable with that. We can do consults in our North Charleston office, our Mount Pleasant office, our Lexington office, our Savannah office, and our Myrtle Beach office. And generally a consult is 1 hour with the doctor. We prefer having a sperm count probably around the same time so we can discuss that result with you and make sure there aren't any male factor infertility issues. We'll go over your history. You'll get a consult with a nurse. And most importantly, you'll get a financial coordinator consult to figure out what your insurance covers and what it doesn't cover. And so that's typically what a new patient visit is with us along the way. So I'd like to pause there to see if there are questions, and then I'd like to ask the doctors to come up and help answer some of those questions. So Holly, why don't you give us the first question for Dr. Cook? Make it a doozy. Make it a really tough one. Okay,
so this is from Miss Brown. And she would like to know, what are some things that will help me conceive? I'm assuming naturally.
Right. So I always tell patients fertility is an interesting thing. It's easy in some senses, meaning you don't have to be doing anything crazy, any special positions or any of these kind of old wives' tales you hear about. But it's also not that easy, because it's really not the most efficient process. And pregnancy rates monthly, even in someone who's very fertile, is only about 20% per month. So overall, kind of good health concepts, minimizing alcohol, caffeine, healthy lifestyle, all of those things. And then just really being sure you're kind of tracking your cycles and time and intercourse appropriately is really what we recommend kind of when you're trying on your own naturally.
Great.
Yep.
Okay.
And then Amanda would like to know,
how many amino acids are in the insulin receptor, right? No? Is that it? No. All right.
what is the first acceptable BMI for a heavier woman? She is 5'1" and 268 pounds, and that's for IVF.
So for patients prior to pregnancy, we want you to be at your healthiest weight, both for your overall health and to have your healthiest pregnancy. So we that work on weight reduction from the beginning. And so that's working on diet and exercise. And if we need to get a nutrition consult along the way or see maternal fetal medicine, our high-risk doctors, we're certainly involving them too. IVF does involve IV sedation in the office, and so to be able to make sure we are protecting your airway, we do recommend a BMI under 40. Now, I have lots of patients that we are actively working towards that goal, so certainly we can be doing a lot of the evaluation while we continue to work on weight reduction.
Okay. Who's next?
Dr. Sloan.
Okay, Just a Jim wants to know, aside from surgery, are there any other ways to combat fibroids that may be the cause of infertility?
The answer is yes and no. There are multiple ways to deal with fibroids. There is uterine artery embolization, where beads are put into the uterine arteries to block off the blood supply to the uterus. The fibroids have a more tenuous blood supply. There is ultrasound-guided ways of killing the fibroids, almost like a laser, except using sound waves to do it. The problem is these things don't really work very well for fertility patients. Uterine artery embolization is the most studied one, and it shows that, number one, miscarriage rates are very, very high. They can be as high as 70%. Well, we're already working hard to get there. We don't want to do that. Second thing is that in about 5 to 10% of the patients, the block of the blood supply is so good, it kills the uterus and it creates a need for an emergency hysterectomy. Then we get to start borrowing things, starting with the uterus. Another thing that can happen is those beads can go up what's called collateral circulation, and it can kill the ovaries. Again, that occurs 5 to 10% of the time. So then we get to borrow eggs. So that's why we don't think those technologies are particularly good approaches for fibroids in women who are trying to conceive. Certainly, if you're at the end of your reproductive lifetime and you're in your mid-40s and you're in your 50s and you're menopause, these are great techniques that can be used to try to avoid surgeries. But the surgeries depend on where the fibroids are. If it is a surgery where the fibroid is right in the uterine cavity, you can do hysteroscopy where we put a scope in the uterus, and that involves no incisions at all. However, if the fibroids are really throughout the uterus, there is robotic approaches, laparoscopic approaches, as well as the open approach, and it really just depends on the size and the number of the fibroids. But on top of it, everything depends on the size and the number of the fibroids, and there are many women that we treat who have fibroids that we're not even doing surgery on. So it really depends on a thorough evaluation, but for the vast majority of the women where the fibroids are thought to be a problem, surgery in one shape or form is going to be the best answer.
Great. All right.
I have another one.
All right.
Okay, this is from Delisha. Do you still need a referral from a primary physician? If so, will a previous referral still work over a period of time, or will you have to get a more recent referral?
From our standards, we're happy to see you anytime without a referral. There may be some insurance requirements for referral, and so I would probably check with your insurance provider. It's pretty rare nowadays. Most insurances will allow you to see a subspecialist without any additional referrals or anything else that's needed. So generally don't need a referral to come and see us. What I would do is advise you just to call our office. Again, that phone number, 843-883-5800, and ask to talk with the financial coordinator. And they generally will have experience with most insurance providers within the state, and they'll help you understand if you need a referral or not.
Okay.
All right. Well, I am glad that you all were able to attend. I think the next seminar is going to be done by Dr. Slowey. Do I remember correctly? The 5th of November, yes, which is a Thursday. And we look forward to seeing everybody there. You can get to us at that same link. Coastalbabies.com, was it CFS Baby? CFSbabies.com, and that'll bring you right to this link, and we will see you then.